Yeah. Good evening, Dr. Sharath.
Good evening, Dr. Bindraj.
Yeah, good evening. So, good evening to one and all. We have joined live streaming of this YouTube channel for flu vaccine. Uh, we'll be discussing today with Dr. Sharath regarding the indications, what are advantages, disadvantages, and who all need to be vaccinated and what. So, today we have Dr. Sharath, who is a rheumatologist at Optima Super Specialty Hospital. So, I'd like to hand over today's talk to him. Sir, you can start, sir.
Thank you, Dr. Bindraj. So, basically, the whole point of having these meetings is so that uh, we can have some online session where we can explain to the lay public as well as to the patients certain things that they can do for improving their health. And uh, these are held every month, and different topics are discussed. So, if you have any other, for everybody who's watching, if you have any doubts during this meeting or during any subsequent meetings, please put them in the comments, and we will be happy to address them either during the meeting or later on. But other than that, if you have any concerns with respect to, or you want to have, want us to have any meeting with respect to any specific topic, then
Correct.
please do mention them in the comments, and we will be happy to take up those topics during later meetings. So, given that this is to help people to improve their health, we thought that we will have a discussion on flu vaccination. So after the before the COVID epidemic, I don't know, Dr. Binduraj, whether you face the same thing, but before COVID pandemic, whenever I used to tell my patients that they have to get vaccinated, they would be very surprised that vaccines is only for children. Why are you suggesting it for adults? So nimdu ಅದೇ experience ಇತ್ತಾ?
It is the same, sir. The adult vaccination is not so good, or in the practice in India at least. So in the Western countries, that is the norms. We have separate vaccination schedules, planners for the adults. In India, it's very infancy. It's in a very infant stage. So it's definitely everyone is facing the same situation. When you ask for a vaccination of adults, little vaccination adults, oh, they're surprised. Uh, so that happens. But nowadays in Manipal, where I practice, there also some people come directly asking for a vaccine. So just they want a guidance. So those people are once okay, that's not. But mainly we need to educate the general public regarding this adult vaccination. So vaccine preventable diseases can be addressed, especially in immunocompromised. In your practice, we see a lot of rheumatology patients who are on immunosuppressants, adults, so with diabetes, hypertension, and cardiac failure, hepatic failure, renal failure, in my practice as general physician, I do recommend adult vaccination very much to all my patients. So who are keen, they just approach, come back again. So then we give the informations for them, and we educate them. So it's like an informed decision from both the sides. So they ask what are the indications, contraindications, who need to vaccinate, when I can vaccinate, what's the duration now of vaccine protection, when do I get protected? Today I have to start vaccination, am I protected tomorrow? There are a lot of questions. So those things we can address today. So Dr. Sharath, please continue.
Definitely, I agree with you, and I've had a similar experience. Definitely, I feel that there is a change after the COVID pandemic. After COVID pandemic, and then COVID vaccination being given to everyone, people understood that vaccines are not only for small children. That there are vaccines can protect and can potentially protect even adults from infections. But yeah, tell me, Dr.
The
Bindra.
other way around is many people are hesitant to take vaccination after the COVID vaccine experience. So both the ways it's there. So they are a bit hesitant to take a vaccine, even though if they know there's a vaccine, and some people hesitant because we have seen or heard in social media that because of the COVID vaccine, there are a lot of cardiac complications, thrombosis and all. But I like to clarify, there is no such things. Okay, everyone is safe, means with a recommendation of a doctor, they can get vaccinated.
I agree. I agree completely. So, one of the things that I tell patients is that uh, yes, there is a potential to vaccinate a lot of people who are adults, but there are especially if they have, as you said, when they have certain conditions which can affect their immunity. So the easy way that I simplify to patients is that if you are elderly, extremes of age. So if you are younger than 5 years, or if you are older than 65 years, then definitely your immune system is slightly on the weaker side, and you would definitely benefit from being vaccinated against certain infections, and influenza is one of those infections. So just like we have the COVID pandemic, and we had like a lot of people who had suffered from COVID. Similarly, almost 100 years back, we had something called as the Spanish flu, and that time, uh, in fact, uh, after the World War, when the Spanish flu occurred, people feel that more people died due to the Spanish flu than due to the World War. It was very devastating. And people remember the COVID pandemic, but nobody remembers the swine flu pandemic, which occurred before the COVID pandemic. So, flu is something which has been causing pandemic quite frequently, and experts believe that it is the way the virus is that it is likely to cause problems, continue to cause problems as we go forward. And we will discuss about. I will discuss more about that when we are discussing about why we need to take a flu vaccination every year. So there are infections for which you can get vaccinated only once, but flu is not one of those infections. So why you have to get vaccinated against flu every year, that we'll discuss later on. Coming back to the people who need to get vaccinated. So as I was mentioning, extremes of age. If you are less than 5 years of age, or if you're greater than 65 years of age, then definitely you need to be vaccinated against flu. In addition to that, if you have any problem with your brain, with your lung, with your heart, with your kidney, or your immune system, so easy to remember. Any patient who has asthma, any patient who has had a heart problem, any patient who has chronic kidney disease, and in fact the liver also, patients who have had chronic neurological conditions, and patients who have weakened immune system. For example, rheumatology patients. So patients who have autoimmune diseases, they are on medications to control their immune system. And in addition to that, the disease itself is more busy. Disease causes the immune system to become more busy in fighting the body instead of fighting against the infection. So definitely patients with autoimmune diseases are at higher risk of infections, and they need to be vaccinated. So these are the broad categories of patients who need to be vaccinated. Of course, the big disease which predisposes to a lot of infections, which is diabetes. So, Dr. Bindaraj, in your practice, do you see diabetes patients who have a lot of infections, especially lung infections?
Correct. Most of the patients come with a lung infection, then they are diagnosed diabetes.
Oh,
Yeah,
okay.
this is a major thing. Next is a urinary tract infection. So this is a very uh, dramatic thing. They come with the pneumonia. We tell this you are having diabetes. They are shocked. So diabetes incidence usually it will be more than 6.5 HbA1c. So that's enough to down your immune system. So yes, definitely we get a lot of cases.
So, diabetes is a very big risk factor for developing infections, as Dr. Binduraj was saying. And in fact, especially elderly people and patients with diabetes, patients with heart problems, and patients with problems with their immune system, cancer patients who have taken treatment for cancer, all of these patients are likely to have serious infections. So, when we say flu, many patients think that we are referring to only cold and cough kind of thing, which is not inaccurate. It is not untrue. Like many patients who develop flu, they have only mild fever, or they might have a little bit of cold, a little bit of cough, and then after a few days they recover. But the problem is that the flu vaccine, in a significant percentage of patients, it can cause serious infections, which can be like a pneumonia, which can end up them landing in the hospital. They can end up in the ICU also. And in fact, the WHO, the World Health Organization, estimates that around 7 lakh people die every year because of flu. So, have you seen patients with severe flu getting admitted and then landing up in the ICU and all, Dr. Bindaraj?
Yeah, definitely, sir. We had a young, in the past 1 year, I encountered two young patients. One is around 24-year-old girl, another one is around 18-year-old boy. Both had initial diagnosis of flu, but it was diagnosed late and they landed up in ICU and both were ventilated.
Oh my God.
It's very serious. Just think about the young kids. And then extrapolate that to their adults who are immunosuppressed and they are already having diabetes or kidney problem or liver problem. Their mortality is very high in such conditions. Especially
So,
the mortality is because of your secondary bacterial infections which take over from the flu. Flu per
that
se,
is
it will lay down the foundation for bacterial infections. So if you want to prevent a bacterial pneumonia, treat means you prevent flu. So most of the bacteria are taken care of immediately.
That is true, sir. Flu patients not only suffer because of the flu, but they seem all their the ability of the body to fight against any kind of infection seems to disappear suddenly, and the bacteria tends to cause the pneumonia and generally worsen the course of the illness. That is a serious problem. In fact, I had a patient. She was an elderly patient of 65. She had mild rheumatoid arthritis. She was not on any major medication also, but her granddaughter, who was I think 2 years old at the time, was she developed a flu and she was admitted to the hospital. And because the parents were working, there were nobody else to take care of the child. So the grandmother had gone to take care of the child in the hospital, and there she caught the flu from the grandchild. And though the grandchild recovered, unfortunately, my patient, she passed away. So she had a very serious and severe course of infection. She landed up in the ICU. She was put on the ventilator, and despite that, we were not. I mean, nobody was able to save her. So that was a very sort of eye-opening episode which I came across. And though I used to regularly tell all of my patients to take the flu vaccination, especially after that, I thought that every year we should at least have this kind of public dissemination of information, as you said, so that the public becomes aware that it is such an easy intervention. You just go to the doctor, you just
Exactly.
take the injection, and it's
On
done
top.
within 5-10 minutes. Everything is done, and that can possibly protect you from serious infection. So definitely, the flu vaccination is something which is a very reasonable and very easy intervention which anybody can undertake. Uh, uh, yes, sir.
I also come across patients who are vaccinated and they come with symptoms. So they ask, I've been vaccinated, why? And most of the time it is only a mild illness. I just it's a mild illness and they don't need any medications, just except only for fever or small sore throat, they need antihistamine, that's all. So even if they have an infection, it's a very mild variety and they don't land up with most of the complications what we have discussed now. So that's one good thing.
That is true. That is true. Even I have many patients who take the vaccination, but then they come and tell me, doctor, even though I took the vaccination, I'm having this cough and cold. So I tell patients the same thing, that taking the vaccination is likely to protect you from serious infections, and
Yes,
it's likely to prevent you from landing up in the ICU or in the hospital.
yes,
This thing, but it might not completely protect you from all infections. I mean, any kind of infections. You might still develop mild cold or cough.
yes.
So sometimes when I tell patients about this, that that extremes of age and patients with rheumatology problems and all of them, they have to take the vaccination. The patients, attenders, and relatives who might be in the consultation room at the same time, they also ask, "Can I take the vaccine? I don't have any problems. I don't have any diabetes. I don't have any rheumatology problem. Can I take the vaccine?" So, what do you? I'll tell you what I answer when
Uh,
patients ask that questions. But what do you say, Dr. Bindraj, when somebody
I
asks?
say get vaccinated. Because if there are any persons who are like in the same age group or who are immunocompromised, so they are more likely to bring the infection to them. So
Exactly,
yeah,
exactly.
even though they
So
don't get a severe variety, they can again infection. So there will be flu-like symptoms, influenza-like illness maybe for 3 to 5 days. So better avoid everything. So get vaccinated. And moreover, we don't know whether they are diabetic. They will tell I'm not a diabetic. That's what I was telling. When they land up in a hospital, we check for diabetes. They'll be diabetic. So it's better get vaccinated because we have seen diabetes is rampant now. If you just screen 10 people, 5 to 7 who are not diabetic will turn to a pre-diabetic. So we have seen pre-diabetic patients also landing with troubles. That means the diabetes, even though it's not manifested, the symptoms of immune suppression are seen. Better get vaccinated.
I agree. I agree with you completely. In fact, I tell patients that like patients' relatives, when they ask, should I get vaccinated? I tell it is worthwhile for anyone and everyone to take the vaccination. And in fact, in my household, everybody gets vaccinated,
Right.
including my son, and in fact, including my maid as well. So everybody gets vaccinated against the flu vaccination. So we are also getting some questions. So I think Apurva has asked whether somebody who gets vaccinated can still catch the flu, and I think that question was answered. That
That's
they
good.
can still sometimes catch the flu, but the symptoms will be very mild, and the severity of the illness will definitely be reduced. Um,
And,
yes, sir, please.
so not every cough and cold is flu. It could be a regular adenovirus or rhinovirus infection. So that has to be addressed individually. So we can't call every cough and cold as a flu. So it's better get it tested. The thing is, testing is costlier than treatment. So better we start treating and vaccinating. Even the cost of the treatment is so costly that vaccination as well as your prevention things are very cheap. You can vaccinate 3 4 persons with the same cost, testing and medications.
True, I agree. So, especially the way healthcare costs have increased in India, it makes a huge, if not, if not to improve your health, at least to make sure that don't land up in economic trouble, so that to
Ah,
reduce your
exactly.
economic burden, uh,
Exactly. Exactly.
that you should definitely consider taking the vaccination, because just taking the vaccination once is a simple injection, and if you develop the infection, then taking the medications, getting the tests done, taking time off from work, all of that will cost you a lot. And in
Additional
fact, it
burden.
can cost your family members also, because if somebody else is looking after you, they might have to take holiday and their pay might get cut. So that way, if you look at it, flu not only reduces your like not only maintains your health, but probably helps to maintain your wallet also.
Yeah, correct. Exactly.
So, in addition to that, we are getting questions from Jeevan and Pramila, and they're asking why the flu vaccination has to be taken every year. So, I think I mentioned this when we started the discussion, that
Point.
many vaccinations, you take one or two vaccines, and then you're able to have that immunity for almost lifelong.
Correct.
But with respect to flu, you have to take the vaccination every year. And why is that? So, actually, if you take a flu vaccination today, you are protected against that particular strain or that particular variety of the flu virus. You're probably protected against it for many years and maybe decades together. But the problem with the flu virus is that variety or that strain of the flu virus will not remain in the same way. The flu virus keeps mutating continuously. That is one hallmark of the flu virus, and that is why we have had, the swine flu pandemic, Spanish flu pandemic, and many doctors think that again the next pandemic is going to come from the flu virus only. So the flu virus is a type of virus which keeps mutating continuously, and because of that, you have to take a new vaccine every year, uh, which is designed according to the new strain of the viruses which have come. So let's say there is a particular strain of the virus right now which is circulating and causing flu. If you take the vaccine, you'll be protected against that. But after, let's say, 6, 8, 9 months, because of constant mutation, the strain of the virus changes. And when the strain of the virus has changed, your immunity will no longer be able to protect you against this new strain of the virus. And that is why every year the World Health Organization releases a list of the new strains of the viruses, and according to that, a vaccine is produced, and this vaccine is marketed throughout the world. So that comes to the with that we can discuss about the timing of the vaccination. So if the flu vaccination changes continuously, then why do we decide to vaccinate once a year? Uh, that is also a doubt that one of the patient asked me. So that comes down to basically how active the flu virus is. So you might have noticed, patients and public might have noticed that cough and cold does not, or flu does not occur throughout the year. There are some seasons in which you're more likely to develop cough and cold, and similarly, more likely to develop flu infection. So, in India, especially most of India at least, including Bangalore, that usually happens during the monsoon. So, June, July is when we have the peak of flu circulation as well as flu infection, and therefore the new strain of the viruses and the new variety of vaccine is usually released around this time, March, April, May. So that is when ideally you have to get vaccinated. So you get vaccinated and you are ready for the flu season, which is usually going to start around the monsoons. So I hope that has answered your question, Pramila and Jeevan. So Sarita asks, how long does the protection usually last? For how many days? So, Sarita, the protection, as I said, against that particular variety or that particular strain of the flu virus, the protection lasts for a very long time. But the problem is that the flu virus is continuously mutating, and every season it changes. So, that is why practically you have to think that the flu vaccination will protect you till the next monsoon. So suppose you take the flu vaccination in, let's say, January, or let's say in December or November, then it is protected till the coming monsoon, till June. Suppose you take it now, April, May, then it is protected till the next monsoon. So basically, the protection lasts for till the new strain of the mutation, the virus mutation occurs. So therefore, the vaccination is given every year, but that does not mean that if you have taken the vaccine in January or in December, then you wait till January or December. No, you have to get vaccinated before monsoon. That is what you need to remember. So if you have not got vaccinated just before the monsoon, then please remember to get yourself vaccinated. I hope that answers your question, Sarita. So, sir, in your practice, do you have patients who come at the right time for vaccination? Do you have patients who come in just before the monsoon, or do you have patients who come in at different times for vaccination?
It's
What do you
random,
see?
sir. It's random. Random. Hardly we get any patients coming like as you described. No, no, we don't get it. They walk in, we just give the information, they come back in the second or third visit, they are ready for vaccination. That's what the acceptance itself is a bit difficult. So there is some hindrance, definitely. We'll have
What
to.
I have seen is that many times when the flu virus starts circulating, and in fact, when the newspapers start reporting it, that there's a lot of flu cases, that is when patients start panicking, and that is when they start coming in for the vaccination. Now, it is a good thing that, yes, sir, yes.
If they get vaccinated today, after how many days the vaccine protection starts?
Yeah. So
This is most
that was,
important
yes,
because
that was
just
the,
now I have an inpatient. He's 55-year-old. That means newly detected diabetes with the flu, and he's worried about his son and his parents. He's telling, can they get vaccinated now? So they are already with him. So these two questions.
so that's a very valid question, and in fact, I've had patients who have asked similar question. So what I tell patients is that usually the flu vaccination takes up to 2 weeks to
Exactly.
start, 10 to 14 days when it is able to start protecting you. So uh, if you have already developed flu-like symptoms, taking the vaccine now will not protect you. If you
Correct.
have already been exposed to the virus,
Correct.
then taking the vaccine now is unlikely to protect you.
Correct.
But it's always a good idea to take the vaccine because you don't know which kind of viruses. As Dr. Binduraj also said, that many times you might have cold and cough that might be due to some other virus. So just because you have had cold and cough, you should not assume that you have developed immunity or you've gone, now you've developed flu and you don't need to take the vaccine. Please remember to take the vaccination. So this increased acceptance of patients or this tendency of patients to come and get themselves vaccinated, I have found that more commonly in patients who are from the corporate side or patients who are young working professionals. What have you seen in your
Yeah,
practice?
same. Usually there are frequent travelers, international travelers, or they keep traveling, juggling between the cities like Delhi on the metros. So they are more concerned. Once they know there's a vaccine, they drop in. Yes, I want a vaccination. That's one common thing. And another thing is, if you are already infected, it's been proven you have flu, still you need to get vaccinated.
So basically, there are in a flu vaccination, there are four different types of strains of varieties, you can say, or four different types of
The
flu
tetravalent
viruses, which
or strains in
tetravalent, yes, four different types of virus strains which are there in the vaccine and which will protect you against that. And
four strains.
most of the time, what the research seems to show is multiple varieties of flu vaccine tends to circulate at the same time. So during a season, for example, during monsoon, it's not like only one variety of the flu
Yes,
vaccination is circulating. So given that, just because you've had the flu and it's a proven flu, does not mean that you're protected against other
other
varieties of the
exactly.
vaccine.
Yes.
So given that,
Still,
I would definitely say that it is worthwhile to get yourself vaccinated.
Doctor, sorry to interrupt you. There was some breakage in the internet. Please answer that question once again, doctor.
Okay. So the question was that if you have had flu and if it is proven that the flu you have had flu, should you still go ahead and get yourself vaccinated? So the answer to that is that the flu vaccination, there are four different strains of the flu virus in the vaccine, and and at any one point in time, it is not like only a single variety of the single strain of the virus is circulating. There might be multiple strains or multiple varieties of the viruses which are circulating. And just because you have had flu against one variety or one strain of the virus doesn't mean that you're protected against the other strain. So, therefore, it is always a good idea, even if it is proven that you have had flu infection, please go ahead and get yourself vaccinated.
correct.
So many patients, as you were saying, many patients, when we recommend the vaccination, they're worried about what will be the problem, what will happen if I take the vaccination and all. Have you faced similar issues in your practice as well, where the patients are asking about side
Definitely.
effects or contraindications?
They definitely ask whether I am a candidate for the vaccine. So if I take a vaccine, what are the problems I will face? So usually it's a very mild symptoms like fever, injection site pain, that's all. And most of them who are vaccinated, they are fine, no problems. What about your experience?
Yes, same. Maximum some local site pain might occur, but the flu vaccination, unlike many other vaccines, including the COVID vaccine, does not seem to cause that much systemic reaction in in the form of body pain, fever. All of those things don't seem to occur commonly in the flu vaccination, and it is generally considered a very safe vaccine which anybody can take. Some patients can have an allergy to the vaccination.
Correct.
So if you have taken a vaccine, flu vaccination before, and you have had an allergy, especially a serious kind of allergy called anaphylaxis, then definitely those patients need to avoid taking flu vaccination again. But otherwise, as I said before, flu vaccination is very safe. And in fact, I've been giving it to my son since he's been 6 months old. So I would definitely recommend everybody to take it.
Another question. Uh, what other vaccines can we use when the patient has come for a visit and is ready for a vaccination? So multiple visits can be avoided and you can vaccinate for multiple conditions.
I agree with you. I agree with you. So this is something which the World Health Organization calls a missed opportunity. That when somebody is in the mind frame to protect themselves from certain infections, then definitely it is worthwhile to take vaccination at that point itself instead of delaying it further. So, given that it is the World Health Organization as well as medical companies also, their research has been done to see whether you can take multiple vaccines at the same time. And yes, most vaccinations, you can take them at the same time. There are certain precautions that you need to remember. One is, as far as possible, take them at different sites. For example, there is pneumococcal vaccine also. And now the new variety of pneumococcal vaccine which has come, which is conjugated and protects yourself against 20 serotypes of the bacteria. And that, as well as the flu vaccination, that gives lifelong protection. Pneumococcal vaccine, especially the conjugated vaccine, gives lifelong protection. So that can be taken along with the flu vaccination. So the recommendation is you can take the flu vaccination on one arm and the pneumococcal vaccination on the other arm. If you're taking more than two vaccines at the same time, which is also safe and which is also something which can be done, then it is recommended to keep a distance of at least 1.5 centimeters between the two injections, so that if later on you develop any reaction, then we will be able to know to which vaccine you have developed this problem. So otherwise, taking multiple vaccinations is definitely safe and is something that I think all doctors as well as patients should be comfortable going ahead with.
Another question. What about the awareness among the doctor community regarding this adult vaccination?
So unfortunately, that is also something which is less, in fact, than it should be, and that is something which is being addressed by programs called continuous medical education, where other specialists and other big experts are talking to doctors and trying to make them aware that patients need to take these vaccinations. But unfortunately, many doctors might not be aware that these vaccinations are, one, safe, two, very important and essential for maintaining health, and three, they protect not only you or not only the patient, but also they protect your other family members also, because when you take the vaccination, you are unlikely to transmit the virus to somebody else. You are unlikely to get infected, and if you get infected or even if you don't get infected, then you will not transmit the virus to somebody else. So therefore it is like a public health program. So definitely it is something which I feel that the awareness is less. It is slowly improving, but at this point in time, I think more and more people or patients directly need to be aware and they need to take responsibility for the vaccination themselves. So to everybody who's seeing this, please go to your nearest doctor or nearest physician. In Optima Hospital, we are having flu vaccination, which will be available shortly, and you can just walk in and contact the nurse, and you will be given the vaccination. But otherwise, you can please go to your nearest doctor, clinic, or nearest hospital, and if you tell them that you need to take the flu vaccination, I think most places they will be happy to give you the flu vaccination.
Yeah. So any questions
So
in the chat box?
yeah, I think. Sorry, sir.
Any more questions in the messages?
No, we don't have any more questions, and I think we have completed the time. So this was a wonderful discussion. I hope that everybody who's watching had an illuminating experience after this, and I hope you have understood that taking the flu vaccination is something which will protect not only you but also your family members and the general community as well. So if you have any of those risk factors for the vaccination which we had discussed in the beginning of the video, please go and take the vaccine.
Yes, sir.
Anything else, Dr. Pindaraj?
Yes, sir. Thank you, Dr. Sharath, for giving a very good awareness among the adult as well as the public as well as the doctors to be aware of the availability and the uses and the benefits of flu vaccine. Thank you very much, Dr. Sharath.
Thank you, Dr. Pindaraj.